The provision of healthcare in Nigeria remains the function of the three tiers of government: the federal, state, and local government. According to statistics, less than 50% of persons in Nigeria have access to healthcare. But with the incoming administration to be headed by the President-elect Bola Tinubu, he highlighted healthcare as one of his major reforms when he gets into power, highlighting challenges like inadequate infrastructure, overburdened workforce, poor insurance coverage, inadequate preventive care, amongst others. In his 80-page manifesto, he is set on improving the healthcare fortunes of Nigerians and enabling more people to have quality healthcare. Joining us from our Abuja studio is a consultant neurosurgeon, Federal Medical Center, Abuja, and a reform advocate from the Nigeria health sector, Dr. Douglas Emeka Oko. Thank you for joining us on TVC Breakfast.
Thank you very much, and good morning to you, Mike, and Veronica. Thanks for having me.
Good morning. Welcome.
Right. Now, when people talk about the health sector in Nigeria, it leaves a bad taste on their lips. And one wonders, when you look at the level of rot in the system, the incoming administration, where should they even begin from?
I think basically, as a background, we remember in November 2022, the National Bureau of Statistics talked about this 133 million people that are multidimensionally poor. And then when you look at these dimensions, you're actually talking about access. And the access is about basic healthcare, health and hygiene, and basic education. So a president sworn in on the 29th of May 2023 has his work cut out for him. Extremely important. If you look at what we call the Sustainable Development Goals, out of the 17 of them, healthcare is number 3. Healthcare is fundamentally important. As individuals or as groups, as communities, as a state, as a country, we all prioritize what we think is important. For a very long time in Nigeria, healthcare has not been a priority. And so what we want to see, the president who comes in sworn in on the 29th of May 2023, and all the governors, we want to see them having a posture in terms of their body language, in terms of their non-verbal and verbal communication, that they understand that healthcare is important, extremely important, that they know that this 133 million people, that when it comes to good governance, that one of the key things that they must invest in for these multidimensionally poor people is healthcare, especially primary healthcare. That's extremely important.
Right, Doc. Talk to us, basically. We've often talked about the issue of healthcare and the poor health system in this country over the years. But if you have to pinpoint what the challenges are that is making us not to overcome this thing, what do you think is the problem? What do you think is at the core of this perennial, consistent challenge we have in the health sector?
So, Mike, I just talked about the first one. The first one is that governments at all levels in Nigeria have not prioritized and have not taken healthcare as a mainstream socio-political issue. And that's why it's always been an aside. It's always been something that we always forget about and only talk about during electioneering campaigns. So that's the first thing. Second thing is, when you look at healthcare is a system, okay? And there are components of that healthcare system. Key components are leadership and governance, healthcare workforce, service delivery, funding and financing of healthcare, health information systems, data, and all that, and of course, medicines, vaccines, and all that. Well, of course, I'd like to throw in one extra thing: monitoring, evaluation, research, audit. Okay, those are some of the key components. All these components we've not mainstreamed, we've not invested in them, and we want to see governments coming in May 2023 really looking at these areas and investing in them. One of the key things we want to see is that the president who is sworn in May, and all the governors need to come together. They need to have an emergency meeting where they declare healthcare as an issue of national concern. It's extremely important. In that sort of meeting, that sort of emergency meeting, we want to see them actually set an agenda in simple language that all of us can follow, and so that we can actually hold them to account. I know that there'll be manifestos and stuff like that, but we want to see that kind of meeting at least within the first 4 weeks of government coming in May 2023. They have to set an agenda, and they have to actually put strategies on ground of how we can actually reform our healthcare system. So key answer to your question, Mike, is that we've not invested our energies, our resources in all the components of the healthcare system that I just mentioned.
All right. Now, you mentioned some things that I would like for you to shed more light into. You talked about they should have perhaps an emergency meeting where they set an agenda for the healthcare sector. And I'd like for you to perhaps paint a picture of what that agenda should constitute for the next 4 weeks, like you mentioned, when they're coming.
Okay, so first key thing, we want all hands on ground straight up. Okay, so we want a situation where Minister of Health, Minister for State for Health, all the commissioners of health, they all come on board straight up. Okay, we don't want a situation where you're having 5 months, 6 months, you're waiting for the team who's actually going to hit the ground running. So that's the first thing. Second thing, we need to concentrate on leadership and governance within healthcare. We want a situation where we put forth a strategy where we have an integrated healthcare system, what we call healthcare under one roof, healthcare under one umbrella. We want a situation where we start looking at all our organizations and strengthening them, especially all the organizations that have to do with healthcare is an issue that cuts across most of the ministries, the departments and agencies. So we want to see interagency, intergovernmental cooperation, collaboration and partnerships. This is very, very important. Issues of reforms and revamping of our accountability and our accountability mechanisms, especially when it comes to key issues of regulation of the healthcare workforce. Okay, we really need to strengthen that because we are looking at trying to build up a healthcare system that is worth its salt, that has some fundamentals of safety and quality. So leadership is really important. Leadership that is actually coming to actually integrate our healthcare system. Our healthcare system is very fragmented. Second thing, funding and finance, extremely important. Like I said, you only put your energies and your resources to things that you think are important. Remember, SDG, Sustainable Development Goals, healthcare is number 3. It is that important, okay? So funding and finance is extremely important. Remember the 2001 Abuja Declaration, 15% of our budget. Yes, we have many things that are competing for our budgets now. Security is there, power is there, and stuff like that. But we want to see over time, at least in the first 4 years, the 4 years of the government coming in May, we want to see this stepwise cumulative increase of the budgetary provision to actually to show them, hey, they understand that healthcare is extremely important. Of course, the National Healthcare Agency Act, we need to make it work. We need to make sure that the National Healthcare Agency Act, in terms of the national social insurance, is integrated and coordinated with the state ones as well. We're having too many duplication of functions and waste of resources that we don't even have in the first place. Of course, we need to have special taxes of things like tobacco, of alcohol, okay, maybe data and stuff like that. Of course, we need waivers. Healthcare is so important that when it comes to the consumables, heavy duty equipment and stuff like that, we need to have waivers in terms of actually importing some of those stuff as well. So that's funding and finance. And that very key issue that they must mainstream is the healthcare workforce. Very, very, very important. When it comes to building the capacity, when it comes to looking after them, creating the right environment for them to work in, and make sure that you have a healthcare worker that is happy, not working in a toxic environment, not wanting to japa. Okay, so that's extremely important. And in terms of building the capacity, we need to actually reform and revamp our educational system. Okay, especially in terms of building the healthcare workforce. We want a healthcare educational system that is fit for purpose, where we actually have what we call competence-based training, instead of just theoretical training. Actually training people in things like health, like leadership, management, and the non-technical skills. This is extremely important. Of course, we already have policies like tax shifting and tax sharing. Okay, we need to make those things actually work. For example, Nigeria has a population of about 215 million and counting. But guess what? We have less than 50,000 doctors. That is not enough. So we must have to start thinking innovatively. We have what we call the community health extension workers, okay, at the primary health level. We must actually now revamp the training and the capacity of those healthcare workers and actually expand their role in terms of the capacity that they have, and actually start doing what we call task shifting and task sharing. Task shifting means that you shift some of the tasks. For example, for doctors to other healthcare professionals, and sometimes you can share the task as well, because we have this significant number, 133 million multidimensionally poor people who are in the rural area who don't have access to care. And so we must think in a local way, global best practices, but acting locally with respect to our own specific circumstances that we have. Of course, we have other things like healthcare information systems and data. We must make sure that our data works. We must leverage our technology, and we must make sure that we bring our diaspora into play. We have a massive talent when it comes to and so this must be strategically done, not just wishy-washy. Okay, very, very important. We have the National Population Commission wanting to do a census anytime soon. That census must be done well, and then we now need to actually make sure that we now synchronize all the things like BVN and stuff like that, because we need data to work with. We need to know who is what, where, and stuff like that, so we can actually plan for healthcare for these people. The key thing, Veronica and Mike, is that when you talk of good governance, healthcare is one of the ways that governments can show that they actually care about their people. Because we need to do all this, and the presidents and governors who come in May need to start mainstreaming healthcare, because the Nigerian patients are worth it.
It's good you have outlined all of these to give us perspective to what is needed to be done. Now, you talked about funding and finance earlier on. The health sector is an area that we don't see so many private sector coming to play. Talk to us about, because if you see the need that we have, the deficit that we have on ground when it comes to health, it's really huge. And it seems obvious that the government cannot handle all of the deficit. How do we begin to get private sector to begin to invest in all of the chain or the value chain of health and the medical system?
Mike, spot on. You definitely need the private sector, but guess what? The component of our national life that is actually going to mainstream and actually create the platforms, okay, and the foundation for us to work on or to actually get the private sector involved will still be the federal and state governments. So what I'm saying is that, first of all, they must get their acts right. The federal government and state government must get their acts right, and then you cannot pull in the private sector. The private sector players have done, in the last 15 years, have done an absolutely fantastic job when it comes to improving the availability of complex care. But guess what? I still go back again to the 133 million multidimensionally poor people. What do you think the major issue is at that point? It is actually basic healthcare. And so one of the key things that we want to see is just a healthcare system that is driven in such a way that we are bottom heavy. We want a significant part of the investments in healthcare to be at the primary care level. We must have a primary healthcare system that actually works. And a serious government in 4 years being their term, can actually create and actually provide the Nigerians with a primary healthcare system that is what it's all, that has some basics in terms of safety and quality. Okay? Clearly, you will need the private sector investing, not just in terms of the investment, in terms of bringing funds and resources in, but also in terms of other things, in terms of the talent and experience, in terms of providing efficiency and effectiveness to actually deliver services, in terms of providing issues of management and governance within the healthcare space. The private sector will definitely have lots of work to do. But key thing, Mike, is that the federal government, state governments, the government itself, the state itself must actually make sure that they create proper foundations in all these components that I've actually talked about. And yet, definitely, you do need the private sector, especially in secondary and tertiary care. But the primary level care, the government must mainstream it. I know that the local governments are saddled with the responsibility for primary care, but I am saying that moving forward, from May 29, 2023, we need federal governments to get involved in the primary healthcare system. We have about almost 9,000 wards in the country, of course, with the 774 local governments. These 9,000 wards, each of them must have a primary healthcare center that is worth its salt. Okay, we must have a primary healthcare center that has community health extension workers, the correct number, that are well-trained, well-regulated, and we must have in that building that is properly refurbished, has power, okay, there's renewable energy, solar, okay? And they must have all the basic things that they need to work so they can actually provide care to these 133 million people that are multidimensionally poor. I'm telling you, from a political standpoint, from an economic standpoint, in 4 years' time, you can deliver a primary healthcare system that is worth its salt. Wow. Because you will have massive respect in the international community. Your healthcare system is one of the components of your system where you actually get respect. And so I'm saying, moving forward, we need to start focusing on our healthcare system across board. All key players who understand that a healthcare system is really, really important, especially when we look at the Sustainable Development Goals and the Human Development Index, must start putting pressure. Because where pressure needs to be put, and we need to start walking the walk and talking the talk. Because, like I said, Mike and Veronica, the Nigerian patients are worth it.
President Muhammadu Buhari had one time promised to revamp the primary healthcare sector, about 10,000 of them. But we do not know what happened in the course of the president's plan, why that was not delivered. Do you know perhaps what happened and what the incoming government should do differently such that, like you mentioned, Nigerians can benefit from the primary healthcare, having access?
Okay, I think key thing, in terms of governance, you have two parts. You have leadership and followership. I think for a very long time, both parts have not been doing their job properly, okay? We cannot vote in leaders or bring leaders in and just say, oh, do you know what, do whatever you want, we'll just be watching you. No. We must put pressure, we must monitor, we must evaluate, we must keep our eye on the government, and we must also be part of it. That is why it is so key, okay, for the president coming in, the governors and stuff, to actually sit down and have that meeting and actually now set this agenda, show us the strategies in simple terms where we can actually follow and where we can actually hold them to account. That is really, really important. See, it's very easy, Veronica, to say different things and make different pronouncements. Oh, I want to set up 10,000 primary health care centers. Talk is cheap. Veronica, okay? And that's why I'm saying that we need governments that are going to take Nigerians seriously and are going to understand that when it comes to good governance, that healthcare is one of the mainstream points, and that across board, the fourth estate of the realm, you guys, the media, okay, all the healthcare professional associations across board, the Nigerian Bar Association, the civil society organizations, all of us must be holding the jugular of governments at all levels and saying, hey, it's not just enough for you to promise things, we will follow you bumper to bumper. And we'll actually have a look at all your strategies and all your policies and everything that you say you're going to do, and we will make sure that they happen. A serious government, like I say, coming in 4 years' time can deliver a primary healthcare system that we can all be proud of, Veronica. So again, it is not just about saying words and just making statements in the media, in the public, or actually having good white papers and legislation and stuff like that. No, we want governments that are serious, that we can take seriously, that can translate whatever we have on paper or whatever into reality, and we will monitor them and we will make sure that all these things happen. Because like I said, the Nigerian patients are worth it. Just like in the UK or the US or Germany, where they have good healthcare, Nigerians need good healthcare, especially the basic healthcare. Primary healthcare system must work.
All right. You talked about the japa syndrome earlier on, and I like you to share with us what impact that is having on the health sector. Of course, we've seen some institutions, some governments of other countries even come to Abuja and come to Nigeria to outrightly recruit Nigerian medical professionals at one point or the other. We've also seen where some countries roll out programs, intentional programs, to attract medical workers from other countries, especially on the African continent. Now that a lot of medical workers have left, what impact is that having on the health sector? Can you share with us what that is?
I think, Mike, the first thing I'll say is that, first of all, every human being wants to be appreciated, wants to be respected, okay, and wants some fundamentals in terms of how their lives actually go, okay? And so that means that every human being will vote with their feet. Okay, every human will want to go to the place where they will actually be able to live their lives to the fullest and actually perform their duties to the fullest. Okay, so that's basic. Okay, now when Nigeria, toxic environment, you've not invested in healthcare, you're not treating your healthcare workers properly, okay, they will vote with their feet. If you have other countries who appreciate the healthcare workers who are coming out of Nigeria and they are creating those very nice environments, good remuneration, they have environments where you have equipment to work and stuff like that, it's simple. People will vote with their feet. Now, the key question is that can you reverse this? Of course you can. A serious government that is actually putting its resources, you understand, and actually, like I said, having a posture and understanding that, hey, healthcare is so fundamental. Healthcare is so central, okay? Doing all the things in terms of investing in all the components of healthcare that we've talked about. Specifically, the healthcare workforce, the human resource for health, understanding that these are a very key part of our human capital within the country, because healthcare is important, and actually doing the needful to actually make them stay back can reverse this trend. Okay, it's only natural, Mike and Veronica, for people to japa if where they are not being treated very well, they don't have the resources. Whether you like it or not, nurses, doctors, radiographers, and so on, they have families. They want to put their children in nice schools. They want to eat good food. They want to drive good cars, stay in good houses. So it's only natural that if other countries, UK, Australia, Canada, the USA, Saudi Arabia, UAE, if they're actually creating better standards for these healthcare workers to actually go to, they will go there. But I am saying that it's not all doom and gloom, that we can reverse this trend. In fact, there are lots of Nigerian healthcare professionals in the diaspora that are keen to actually support and help build capacity and provide training for Nigerians. But the governments in Nigeria must show seriousness, first of all, that they want to actually maintain a particular level, okay, for the healthcare workforce in Nigeria, and also attract them who are outside Nigeria to actually have what we call brain regain or brain gain. Okay, so japa will continue until we, as governments and as a people in Nigeria, we actually start doing the appropriate and right things to actually keep them back.
All right. One of the key concepts of the incoming administration is achieving universal health coverage. And we recall that the National Health Insurance Act 2022 was signed to also achieve that. I wonder how effective it has been between the time it was signed into law and now, and how we can improve on that, especially looking at that's the direction this incoming government wants to go.
Okay, so Katie, Veronica, again, okay, lots of nice legislation, laws, acts, policies, very good on paper. Okay, the National Health Act, yes, 2014. The NHIS, the National Health Insurance Scheme, which is now NHIA. Okay, first of all, in 2002, and now the Reformed Act in 2022, May 2022. These are all good legislations. But I am saying that to actually translate this, your question is, have they worked? Have they been implemented? If you look at the Social Health Insurance Scheme, the National Health Insurance Scheme, the State Health Insurance Scheme, are they well implemented? Do they have good numbers? Do they have traction? Do they have buy-in and stuff? Of course not, they do not. Okay, and again, it's just simple, because governments at all levels, national, subnational levels, are not taking healthcare seriously. We need to start taking healthcare seriously. We need to start looking at all these, our legislations, our National Health Act, the National Health Insurance Agency Act, the State Health Insurance Schemes, and actually start coordinating these things and actually start developing strategies to actually translate these things from paper to real-time action on the ground that actually gives the deliverables to the people, especially those 133 multidimensionally poor people. It can be done. You just need the oomph from governments at all levels. We want to see governments that are taking healthcare seriously. When they can take healthcare seriously and they have that posturing, that they understand what we call value for human life, okay, then you can start translating all these white papers, legislation that we have into reality. Of course, if you truly want to actually deliver any deliverables of good governance, I've said it before, you need data, okay? The National Population Commission going to do the census as well. We need to actually get proper data of who we are, where we are, how many we are, okay, and actually use technology and leverage on technology to actually make things seamless in terms of tapping into the people that we have. Because you need that to plan, isn't it? If you want to actually throw a healthcare insurance scheme to actually work, you must know who you're actually dealing with, the numbers of people, where they are. Are they working within the government, working within the private sector, or are they people who are doing their own private work and stuff like that? You need all that data to actually plan. So moving forward, we need serious governments, we need data, okay, and then we need all key players, the Nigerian populace themselves, all the people that I've talked about before. We need them to continue to put pressure on governments to actually make sure that they deliver a healthcare system that is worth its salt and we can all be proud of, because the Nigerian patients, like I say again, are worth it.
All right. Now, Doc, just briefly, a lot of persons have talked about the need for a homegrown solution to a lot of things, especially in the health sector. We saw the COVID era came in, and when it comes to development of vaccines, we saw how there were calls for homegrown solutions. Just in a second, I wonder what you make of medical research and how much emphasis we should lay on this, considering our capacity and the level of resources that we have.
In terms of when you look at things like monitoring, evaluation, auditing, research, we definitely need to put our resources there. In terms of looking at things like actually vaccines, creating our own drugs, we have the capacity to do it. The problem is that we've just been a rent economy for so long. Everybody coming to Abuja to actually share money and stuff like that. We now need to actually start devolving powers to the states and all that, and actually making sure that the different regions of the country actually create platforms for us to actually start creating wealth. And part of that creating that wealth will actually start setting up businesses, setting up production lines that can actually start producing things like all the vaccines and all the medicines and stuff. Is it doable? Of course it is. What do we need? We need serious governments. We need the Nigerian people to put pressure on the governments. And
Consultant, neurosurgeon, Federal Medical Center, Abuja, and Nigerian Health Sector Reform Advocate, Dr. Douglas Emeka Oko. Thank you for your time on the program.
Thank you for having me.